Welcome back to my channel, Pattern of Good Works. My name is Donna, and today we will be in chapter number 7. The textbook that we'll be using is the Specialty Practice of Rehabilitation Nursing, a core curriculum, the 8th edition. Let's go. So the textbook begins discussing financing. So chapter number 7 is talking about healthcare financing and health policy in rehabilitation nursing. So it starts on page 106 where we talk about Medicare. And we know that Medicare is a federally funded under the Social Security Act of 1965. On page 106, the discussion begins with the traditional Medicare program, which includes the Part A hospital insurance plan that covers inpatient services provided by hospitals, home health care agencies, skilled care only, hospice care, and short-term stays in skilled nursing facilities, SNFs. Most beneficiaries do not pay a monthly premium for Part A services, but are responsible for the deductibles that are required for each benefit period. For purposes of skilled nursing services, a benefit period ends after 60 consecutive days of no hospital or SNF care. It says there is no limit of benefit periods per year, so the cost to clients could be higher. Part A is financed through the CMS Hospital Insurance Trust Fund by taxes paid by employers and their employees. So there are 4 parts to Medicare. That was Part A. Part A. Now, it says people covered by Medicare Part A can enroll in Medicare Part B, which is the supplemental medical insurance program that covers physician, outpatient, home health, and preventative services. It is financed through the CMS Supplementary Medical Insurance Trust Fund by federal taxes and monthly premiums for beneficiaries. Part D covers outpatient prescription drug coverage offered through private companies. Coverage varies depending on the plan chosen and is financed through taxes, beneficiary premiums, and state payments for people with both Medicare and Medicaid coverage. Medicare beneficiaries in the original plan can buy private Medicare supplemental insurance, right? And if they do that, it helps to pay for the costs not covered. And people who select the Medicare managed care option are enrolled in Medicare Part C, which is also known as the Medicare Advantage program. Through private health plans, plans can include like PPO and provider-sponsored organization. It may also include some private fee for service plans. They can have a high deductible plan linked to a medical savings account, and special need programs for people who are duly eligible for Medicare and Medicaid services. So there are 4 parts. You have to remember that there are 4 parts to Medicare. Part A, and this is just a real quick breakdown, is always going to be hospital coverage, right? It's going to be inpatient care in hospital, skilled nursing care, hospice care, limited home health care services. Part B is going to be medical insurance, basically. It's going to be doctor visits, outpatient, certain tests and screenings, flu shots, mental health care. If someone needs alcohol use counseling, they may have chemotherapy and physical therapy, some diabetes screenings, some durable medical equipment such as wheelchairs. Practical. Part C is always going to be linked to Medicare Advantage plans, which includes all of Part A plus Part B plus some additional benefits. And Part D is always D for drugs, prescription drug plan. So this may be some type of available standalone plan or as a part of a Medicare Advantage plan. A little about blood tests. So Medicare covers blood tests. Medicare Part A offers coverage for medically necessary blood tests. And these would be tests that are ordered by the physician for inpatient, hospital, skilled nursing, again, hospice, home health, and other related coverage services. Now, Medicare Part B also covers blood tests, but they are for outpatient blood tests ordered by a physician with medically necessary. And it would be an example would be like a screening test to diagnose or manage a condition. So please remember that Medicare Part A would cover inpatient blood testing. Medicare Part B would cover outpatient blood testing. Lastly, we'll talk about eligibility. So Medicare eligibility criteria on page 106 says people age 65 years and older, if they or their spouse are eligible for Social Security payments, have made payroll tax contributions for 10 or more years, which is 40 quarters, and are U.S. citizens or permanent residents. Prospective enrollees who are age 65 years and older and are not entitled to Part A, such as those who did not pay enough Medicare taxes during their working years, can pay a monthly premium to receive Part A benefits. People entitled to Part A and those age 65 years and older can elect to enroll in Part B. People are eligible for Part C, which is again is Medicare Advantage, if they are entitled to Part A and enrolled in Part B. Enrollees are eligible for Part D if they are entitled to Part A or enrolled in Part B. Remember, individuals who are younger than age 65 years with a permanent disability are also eligible for Medicare Part A after receiving Social Security Disability Income, which is SSDI, for 24 months. People with end-stage renal disease or amyotrophic lateral sclerosis, better known as Lou Gehrig's disease, are also eligible for Medicare Part A as soon as they begin receiving their SSDI payments with no waiting period. This week, we looked at funding sources for healthcare and rehabilitation programs, and we looked under the header of Medicare. We covered the various four parts of Medicare: Part A, Part B, Part C, Part D, realizing that Part A has to do with hospitals, Part B has to do with medical insurance, Part C has to do with Medicare Advantage, and Part D always has to do with drugs. We looked also at medical testing or blood testing, and whether the patient is inpatient, they will have Medicare Part A do coverage, and Medicare Part B will cover outpatient services. We also talked about the eligibility, and we talked also looking at the age requirement, the various diseases, whether it be end-stage renal disease or Lou Gehrig's disease. We also looked at status, whether the person is a U.S. citizen. All of these factors go into care of a Medicare patient and whether or not they would be eligible to receive these services. Really thank you for coming along on this journey. I'm asking that you will like, comment, and subscribe. Wishing you all the best. Take care. Be well. Bye-bye.